And, you know, I have to say, when we start out the conference call this morning, whether you're an Iowa fan, a Northern Iowa fan, or a Cyclones fan, you had to love the buzzer beater last night when the Cyclones beat Texas. I don't know if anybody saw the game, but oh my goodness. Great game last night. So let's get started this morning. And I've got a pretty packed agenda. We'll start with some legislative issues, my trip to Washington, D.C., and what that experience is like, co-opportunity liquidation, healthcare reform updates, compliance requirements, some survey questions, and important dates for Wellmark agents. So there's quite a list of things that we're going to go through today. And as always, we'll open it up for questions at the end. You know, I have to tell you, going to Washington, if you haven't been there for a conference such as this, you really should try sometime, whether it's through the Big I, through Health Underwriters, or through NAIFA. I'm going to separate several of my comments here out into sections, the first one being the role of the agent. So I want you to hear and see what's going on at the Capitol with regards to, in particular, the National Association of Health Underwriters. So when you see the HR, that would be your House resolution, and that you know that that's coming from the House. If you're going to see an S in front of the bill, you're going to know that's coming from the Senate. But one of the first things that they're doing in terms of the role of the agent is trying to remove the broker commissions from the minimum loss ratio calculation. If you remember, that was a big darn deal a few years back. And because our commissions are part of those administrative costs that the carriers carry that burden for, if you will, we felt that that was part of what squeezed our commissions, right? So we're looking to pull our commissions out of that calculation, which we think will help support us in this industry. Now, I'm not going to probably go talking to a client about that, but I want you guys to know that that's being fought for on the Hill, and there's a lot of support for that on both sides of the aisle. In addition, we need, and you guys know this, a dedicated broker hotline for us to support our clients on the federally facilitated marketplace. So that's being entertained as well, and I think really it's being driven. And I think we'll see some success there. In addition, a broker portal for the individual market federal exchange. And so as you guys know, that when they built that thing, it was hey, you know, client, set up a login and a password, and there was no place for us. In fact, if you guys remember in our training, you know, we were forbidden to know their login and password. Like, you know, God forbid we should help them, right? So if they can get a broker portal for us, not only can we, I think, have more access to help them, but how about access to just see what's out there? Yeah, so that's another whole issue around, as you guys know, commissions, especially since Co-Opportunity liquidated, and a lot of that business has been moved over to Coventry, then they've had some trouble trying to keep up, and how do they track marketplace applications? We just desperately need a broker portal for us to be able to get in there and see what's going on. Whether you knew it or not, they did add an agent search function at healthcare.gov. It needs to be improved. So they're pushing for improvement of that so that when folks go out there, they know that that's an option for them to find somebody. It needs to be right up front, not buried somewhere in the back. And, of course, continued improvements to healthcare.gov. So those are all some things that are being stirred around in Washington around the role of the agent. The next thing that they're talking about are what we'll call employer issues. So this is where you've got HR 30 and S 30 to restore the 40-hour work week. So, you know, whether or not we're going to actually see it hit 40 or it'll settle somewhere in between, what we've heard, the president said he won't sign something like that to restore the 30-hour work week to 40. And we know that that has great impact in the economy. So kind of keeping eyes open and ears open on that one. The other one is another, again, bipartisan support here on increasing the eligibility and effectiveness of the small business tax credit. So as you guys know, in order to get that small business tax credit, you have to go through the shop. And what a nightmare that has been, right? In addition now, we have no players with these qualified plans here in Iowa any longer, at least in the majority of the counties, I'll say that. There might be a couple of areas where there's some plans in the great Northwest and great Northeast. So they're trying to increase that so that small businesses do offer health insurance to their And then this was an interesting one. There was really a lot of time spent on looking to eliminate the expansion of the definition of a small employer. As you know today, it's 1 to 50. They're looking to expand that to 1 to 100 in 2016. That's written into the law. But they're looking to either eliminate it or at the least postpone it. So more to come on that. And I think I'll just touch on it here as you guys make your notes as we talk through for other comments or questions you have at the end. But obviously, this changes how groups are rated. And the impact to them, as Brenda and I were having a conversation the other day about a particular agent's case, and it was going to dramatically increase their rates for their employees. And if the whole point is trying to hold down costs, moving to this rating structure, as you know, then would really impact the rating if it's at a member level, right, or whether it's composite rating. So there's just there's a whole conversation going on right there in that space. So more detail to come on that. And then last but not least, greater transparency of provider quality and cost data. You know, we spent some time talking about this, and I think we talk about it every year, right? Where is that information? And I think Wellmark's starting to make some headway on that. I think maybe Coventry is starting to make some headway on that. But we're starting to see some of the carriers show this information on a website, so we can go there and see what's happening with the provider. How much does it cost? And/or talk to me about their outcomes, because we do want quality if we're going to try to get competitive on pricing here and whatnot. The next section is around rates. And so here's a couple other things that they're looking at. They're looking at legislation to increase the law's age rating bands from the 3-to-1 spread. You know, do we go back to a 5-to-1 spread? That's what's being entertained there, and that certainly we think might give some relief, especially to those folks in the higher ages. And then another resolution by both the House and the Senate to eliminate the new national premium tax. So that'll be interesting to see too. This is how this whole thing is supposed to be funded. And then some more talk around preserving the law's risk adjustment mechanisms, so those don't go by the wayside. The 3 R's. You've also heard those referred to. And then last but not least, as it revolves around rates, is really looking at the essential benefits and other coverage requirements. There's some talk around having states take a little more control of this, that the feds need to back off and allow each state to authorize which essential benefits or coverage requirements, kind of like we did before the ACA. And then the other section that they talked about, which sometimes I know this is we try to focus these calls around the Affordable Care Act, but Medicare and some of the rights and protections within Medicare, our industry organizations, whether it's NAIFA, Health Underwriters, or Big I, we're all also rallying around Medicare. So some of you may not play in that space, and some may, but just want to let you know that some things that are being entertained there to restore the open enrollment period for Medicare Advantage changes from January to March. I think that might take a little of the heat off so we can prioritize the clients we're trying to serve, right? And then next is changing that 3-day inpatient hospital admission requirement for skilled nursing facilities. Either change and like get rid of the 3-day requirement, or allow observation status to count. So that's, as we know, a big darn deal. And when hospitals start playing with, well, let's just put them in observation status, instead of admitting them, well, that obviously impacts their ability to get nursing care and have it be, covered. And then better funding for Medicare Advantage plans. I know for many of you still aren't selling these. Coventry and United Healthcare, Humana to some extent, I think they all are still offering zero premium plans here in Iowa in the Medicare Advantage space. And the big differentiator, besides co-pays and the drug plans, the big differentiator is your out-of-pocket maximum. And so I just don't see these things going away. And I don't know if you guys are seeing it, but more and more people are taking it. If people are healthy as they're aging into Medicare, they're really considering these Medicare Advantage plans. So, do another check in your area, or give our office a call to just find out. Or you can certainly look on Medicare.gov when you usually go there just to do your drug plan finder. You can click, show me all the Medicare Advantage with and without drugs. So you'll be able to see in that zip code who's there, and then obviously from there you need to check the network. So that's the big issue there. But so we're pushing for better funding for those Medicare Advantage plans. And then last but not least on this slide, I found it really interesting. They're looking for a way to provide some financial incentives to those people that purchase long-term care insurance. That we know that this is a great impactor of folks that are that do their drawdown and get to Medicaid. And so if there's some more incentive that they can give to folks, I don't know about you guys, but we don't focus on it a lot. We partner with Rhonda Vry-Bills. If you need her contact information, just holler at one of our staff. But I know Rhonda, this is all she does, and we're looking at rates are increasing. So for those that haven't purchased it yet, it's time to take a look at it. But maybe the government can help with some incentives here or some other credits. The Supreme Court decision, they're calling it King versus Burwell, and this is where, as you know, this is deciding whether or not, and Iowa is a great example, whether or not we should get subsidies. And check it out there. I was given the number of about 4 million will lose their subsidies across the country for those states that have really facilitated marketplaces. And it's like, I remember we brought this up at a NAFA meeting we were at with Governor Branstad and just said, I just asked the question about, and asked for his comments. And actually, I don't know that the state here in Iowa are really going to do anything about it. And maybe we will once the decision comes down, so maybe we don't worry about it yet. But a couple things could happen, like Congress could amend the legislation with some new language. Now that would take legislation, and what we're finding here with a more of a Republican-controlled Congress, they're not too interested right now in amending the Affordable Care Act. So as you guys probably heard, there was some verbal arguments that were heard on March 4th. There was a little bit of buzz about it just last week, and the Supreme Court will release its decision in June. So more to come on that, but just make sure you're familiar with it. It's King versus Burwell. The Supreme Court, we're waiting to see. And it's interesting that some states have some legislation pending. I haven't heard of anything pending in the state of Iowa. But I also found the other comment there about some federally facilitated marketplaces will private label their state, their federally facilitated marketplace, like in Iowa, to become a state-based exchange. So could we have just a shell, if you will, of a landing page, if you will, for the state of Iowa's exchange, but then we would private label it out to the FF. So there's definitely some conversation going on around how can we in Iowa deal with this if it should happen. So more to come, and stay tuned on that. So now let's jump over to the co-opportunity liquidation, and a couple of things I want to make sure that you're aware of. So we talked about it last month because we knew this at our call last month, that this was looking to be inevitable. But we've got the final liquidation order and whatnot. And so on the individual coverage, remember that coverage will automatically terminate August 31st. So they gave individual policyholders a little bit more time, 180 days. So it will terminate on August 31st, and there will be a special enrollment period for individual members now until April 29th. So there's your little 60-day window for your special enrollment period. So you want to do something, up till April 29th. What's happening is that if you wait and your clients wait all the way until August 31st, there will be no special event at that time. So if they let this thing go all the way till August 31st, they're going to go without coverage then for the months of September, October, November, and December, because there's no more special enrollment period, and they're going to have to wait until the first of the year. All right, as it relates to group coverage, you'll notice here that groups with April 1st renewal dates have until March 31st to move their group. Their coverage will end on April 1st, so the groups have a little bit tighter time. And then notice that those are groups that have April 1st renewals, but all groups with other renewal dates will have until midnight on April 14th to secure other coverage, and their coverage will end on April 15th. So I hope you've got most of your groups moved by now. If you haven't and you need some help from us, please make sure you give us a call so we can help you get some quotes. All right, so now let's talk about co-opportunity commissions. And so because they were announced that they will be liquidated, and we know that we lost commissions. Many of you lost commissions even into, October. Well, I don't know how far into 2014 you lost commissions, but certainly some people never got paid for November, December, and then all of a sudden when this was announced on Christmas Eve, right? Those will be some key dates we won't forget. Christmas Eve, I remember getting that call that morning and saying, oh my goodness, so if many of us then obviously didn't get paid in January either. So we've got months of commissions that are outstanding. And so we will be notified of the amount of commission. And we don't have to really do anything at this point. They're going to send us a list of all the commissions that they believe are owed us. I believe they'll send it to you directly. We will get it as well. And so we're waiting on that. We don't have a date on when we're going to receive that statement, so we know all the back commissions that are due based on, who all paid for their policy. As you know, that's how Co-Opportunity did it. If they paid for their policy, then we got paid. You got paid. So notice that we are not required to submit a proof of claim against them unless we're going to dispute the amount. So we're going to hold on until we get our list of who we're supposed to get paid on. Then we'll have the claim form in our office. You can get it from our commission team, and they'll help you get that completed so we can get that, help you get that sent in. And the deadline is the end of this year, so it's December 15th of 2015. So just hold on. We don't have the list then of what we think we should get paid on. We just know that there has been, it's never been easy, has it, with commissions for Co-Opportunity. So I'm anticipating that we're going to have to fight to help you get what you deserve for your payments on your policies, as we're still fighting right now, so Coventry can get their system straightened out. So there are definitely issues here, and I hope you guys know that when we get paid, we pay you. If you haven't gotten paid, we haven't gotten paid. So, and I know many of you, and we just rolled out a form that we need your help with to complete, because there is no broker portal on the marketplace. We need your help to know when you submit something so we can track it for you. We run at the end of every month a commission not received report, and what that means is in our database, when we key in a client of yours, when you let us know you sold a marketplace plan, see, on all the other carriers, we know either through electronically, or you guys are sending us copies of that as well if you do paper apps. When you send us that information, and you need to do that on the marketplace now as well, we load it into our contact management system, and that's the system that then we do the double check. When we get our commission payments, we can run a report, and we can say, well, okay, we were supposed to get paid on that. We had it loaded in our contact management system, but did we? And if we didn't, now I've got a list that I can go back to the carrier and go, look, this is what we show we should have been paid on. And as you know, when we don't have that information, and you're frustrated because you're not getting paid, and we're frustrated because we can't see the data that they had promised they'd send us, and they never had, until we were supposed to get paid. So anyway, a lot on commissions there. I know I crossed over into Coventry as well, but it is an issue, and we're going to work as hard as we can to help get what is owed you. All right? All right. So let's move into healthcare reform updates. And just as I was talking earlier about possible legislation to postpone this inevitable definition of a small employer group, it's scheduled to move in 2016 from 1 to 50 to 1 to 100. And we know that this impacts the rating methodology, the composite rating, four-way rates, and we've got folks right now we know in the 1 to 50 space that are doing that manually. And so there's a lot of conversation. I know carriers are actually asking us for input, which is really refreshing. What do we think? What do you think? So we'll kind of wait to see what happens if this thing gets postponed or if we definitely move to it. And we're going to have to know sooner than later because, I mean, obviously 1/1 renewals, I hate to say it, but the summer I think is going to fly by, and before we know it, we're going to be on top of this thing and getting renewals. And how are they rating? Also, now this was from our conversation that Brenda and I and our team had with Wellmark. So I want to caution you here because each carrier might do this a little bit differently. This is why this late summer and early fall training is going to be so important, as every fall is. But grandmothered plans the requirement is need to move to an ACA plan in 2016. And we've always heard this October of 2016. All plans, except the grandfathered plans, but so grandmothered plans need to move to an ACA plan. Well, what Wellmark is telling us, and let me just kind of paraphrase what we picked up from our meeting, and we haven't seen this written down yet, and this is why training this fall will be so important, is that if a group renews prior to November, so we're going to include even the Octobers, right? So anybody with a renewal up through and including October, they will get to renew their group with non-ACA. They can keep what they currently have, okay, and not have to move to ACA. But anybody renewing after October will have to select an ACA plan. So really what that's saying is if you've got a group, and I'll just use September for an example. They renew in September of this year. They're going to get the option of keeping what they have for another whole year. So their renewal then in 2016 will reflect the ACA. So in September of 2016, they would then be forced to move to ACA. And there was some question on whether or not, if everybody had to be moved by October of 2016. And Wellmark's interpretation is no, that they don't have to as long as you've got a renewal date October 16th or prior. You'll be able to renew one more year non-ACA. So that's big. I think that's big news because there's so many people just sitting on the fence and not wanting to move to ACA, especially if they've got some good rates on their current grandmother plan. Also, an update, the out-of-pocket maximums for 2016 have been rolled out. Of course, as you know, these are indexed every year by the government, so I just thought I'd throw that out there because it was just announced, $68.50 for individual and $13.07 for family. All right, more buzz and more conversation around the Cadillac tax on premiums over $10,200 for an individual and $27.5 for family. So what they're saying here, and it's just good to know this, you guys, so when one of your clients asks you about what do you know about the Cadillac tax, know that it's the 40% tax is on any amounts, any premium amounts over these amounts, right? So you're not going to get taxed. Initially, I think we thought if you were over, let's say that I had an individual policy, right, and I'm paying $900 a month. If you'll notice my little bullets down there, $850 a month. 850 times 12 is your 10.2, and 2292 times 12 is your 27.5. So suffice it to say that if I'm an individual and I'm paying $900 a month, my individual policy, that's $50 a month more. So that's going to be what, $600? I'm going to pay. Well, the carrier will pay, but guess who's they're going to roll it down to? The consumer. So as a consumer, I would pay 40% tax on that extra $600 in premium above and beyond the 10.2. And then likewise on the family plans. So it's just interesting. So on Monday, February 23rd, you can see that the Department of Treasury issued a notice. And it's interesting because they're asking for feedback, right? This is where they initiate and inform the process where they're developing the regulatory guidance. So they haven't done it yet. They're looking for input, but this is still coming. And so my whole point, I guess, in really making sure that you're clear about this is do the math now with your clients on some of their policies. If they're offering those rich kind of benefit plans, no matter what they're contributing, if they're offering this, they need to know that there's a potential for this premium tax, and maybe it's time to start moving some of these plans to, whether it's qualified high deductible plans or anyway, just being conscious of that. Another value add you can provide to your folks by making sure that they stay under this Cadillac premium. Okay. On the IRS, it's so funny. They release so many things, but now the final forms and instructions for coverage, coverage information rather, on reporting. And what's interesting here is, and there was a nice piece that Wellmark put out in their blue brief just yesterday. And so it's talking about the forms that the employers are required to do, but remember this. and this is what I find is important because people start to get wrapped around the axle on this. The first information reports are due to be filed in 2016 for the 2015 calendar year. So I think it's good now to have the conversation with your groups that have 50 or more full-time equivalents, that they need to be prepared to be able to do this. And I know this next slide is really busy and it's really full of information, but the point here is I want to go down to that second bullet, and it has to do with time tracking and payroll, and also managing if somebody is on disability or leave of absence. All of this information needs to be taken into account because it's not necessarily just saying, okay, here's my people that I offered coverage to, and here's my plan. It meets the minimum coverage, and I offered it to who I was supposed to. But did you? And that's where when we talk about our partnership with ADP and the ability that they have to keep our clients compliant as it relates to this reporting, and did they offer the right employees the right coverage at the right time? And that, God forbid somebody gets audited and somebody says, well, how are they going to know, right? And it truly would come down to some kind of an audit. But if you're offering coverage to somebody and you need to be able to report that, you meaning the client, the employer group, and check it out. Right at the bottom it says that the tracking of the hours, it's not just hours worked, but also hours maybe not worked but paid or entitled to be paid for vacation, holiday, illness, incapacity, including disability, or layoff, or jury duty, or military duty, or leave of absence. So there's so many other factors, and that's where you've got to encourage your employer groups to find a resource that they can rely on to do that time card collection, processing their payroll, and then feeding that information into a system then that can track all this information. So you probably get tired of hearing me say this, but if you're not offering it to them, somebody else might, and you could lose the medical case just because you haven't cared for how they're going to do their reporting. All right. Now I'm going to switch into leaving healthcare reform updates, and we're going to switch into the Wellmark communication that they had both on February 12th and February 19th in Blues briefings. And we got lots of calls, and you maybe didn't even catch it, and that's okay because we clearly needed more clarification. So I need to do a shout out to Lindsay in our office. She just did a fantastic job of pushing back to Wellmark and saying, what do you mean? Put this in English so we can communicate this out to our agents. So here's the bottom line. If you yourself, as the contracted agent, are certified for Medicare Part D through Wellmark, you have already fulfilled your requirements. So if you're a single person agency, there's nothing more you need to do other than you continue to do your certifications, right? And I'll remind you of a couple other things you need to do as an individual. But the biggest requirement right now they keep talking about, and Wellmark's talking about, is really referring to those agents that have employees or staff, right, of a certified agent. And these requirements need to be met then if you have these staff that assist you with PDPs and they're not certified to do that through Wellmark. So these are going to be your assistants. It might be somebody, if you've got a big PC shop going on, or if you've got an investment organization, you've got assistants that are touching your clients. This is who we're talking about. So let's go to the next page. So this is a little, again, it's a lot of information on here, but we've got all this information on our website, the KHI Agent website, under our blog. And our blog is our news button. When you hit news, that's our blog. And so all this information is out there, but check it out. So if you have these employees or these staff people in your office that are assisting your clients and they're not, and your employees are not certified, you need to distribute that code of conduct to those staff members within 90 days of hire and annually thereafter, and retain record of distribution for 11 years. Like, oh my goodness. So start it now. They had a sample little form so that when you hire somebody, just kind of put this in your little hire checklist, right? That if they're going to touch your clients, that you're going to go ahead and deliver this code of conduct to them within 90 days and document it, okay? And then notice, administer the Medicare Blue Rx general compliance and fraud, waste, and abuse training to those members. Okay, and another note here, this training does not certify staff members to sell or market. This is just, they have to go through the fraud, waste, and abuse training. And we looked into this as well, by the way, that they don't have to go through the same place we do to go through that training, because we have to put in our, usually our NPN numbers, and these people wouldn't have those. So we've got it in this very, very extensive email that's now out on our website. You can see exactly where you would click to have your staff look through that, read through that fraud, waste, and abuse training. It's a PowerPoint. They need to go through it, and then you've noted then they've gone through that. And then a couple other things here. Scan the staff members against the federal exclusion lists. Provide information to those staff members about how to report the issues of fraud, waste, and abuse, and or report to Wellmark. The things that, okay, all of that, and that's really related to track you've delivered that information to your employees or your staff, okay, that are helping you. The last three things, number 5, 6, and 7, this pertains to you whether you're a one-man or woman show or you've got employees, but you always need to retain all records related to Medicare PDP for a period of 11 years. Destroy obsolete marketing materials. Now's the time, you guys, get rid of those 2014 materials. Put them in your recycle bin or whatever you do, but destroy those materials, and then provide oversight to any subcontractors for compliance with the same requirements. So I don't know how many of you are using subcontractors, but if you are, it needs to be approved in writing by Wellmark. So again, all this is out on our site and more, okay, but I'm just giving you kind of the highlights here, and hopefully that makes more sense to you. The next topic is around survey questions. Now, before I jump into these questions, you're probably reading them, but before I jump into them, I want to make this comment. We believe in surveying. And I know you guys are probably, like most people, are surveyed to death. Get your receipt from a restaurant, and at the bottom it says, go to this survey and, you know, or this website and fill out a survey. You buy something online, you get a survey. Heck, go to a meeting, I get a survey. How was your meeting? You know. So I know we're surveyed to death. I can't stress the importance of 2 surveys that you're going to be getting this year from KHI and Wellmark. So the first one is KHI survey. We did it last year about this time frame. It was right about in the March time frame. And we did it because we want specific information even at a staff level. We base our evaluations of our staff and their reviews, their annual reviews, et cetera, on how well you rate them and how well they serve you. And it's not a surprise that when you survey someone and say, this is going to be part of your evaluation, people take notice. So you're going to be getting a survey from KHI on how are we doing. And we're going to be asking you things specifically around our staff, okay? Responsiveness, knowledge, et cetera. And we want you to, and if you don't have any experience with some of our staff, you just click NA. I don't know. I don't talk to them. But for those of you that do, we want you to evaluate our staff. That's very, very important. And all the other questions that we'll ask, we'll keep it short. We try to keep it concise. And just click, 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 and you're done. Okay. Wellmark says, hey, surveying is a great idea. In fact, let's take some of the GA's override away, and let's do a survey to their agents. And if they do well enough, we'll give them some of that override back. And if they don't, we won't, right? So again, it goes back to, wow, what motivates people to focus on something? Well, money usually does it, right? You're going to take money away from me. I got to figure out how I'm going to get that money back. And so you're going to see a big focus from KHI on these 7 questions. Actually, the survey from Wellmark, and I've got a timeline that I'm going to talk about later, so I'll tell you when you're going to get this survey a little bit later. It's this summer, okay? But this one from Wellmark is going to come directly from them, not from us. And they actually ask you about, I think it's about 17 or 18 questions, but some of that's demographic. It's going to ask you a little bit about your, probably how long you've been, you know, selling Wellmark product and how long you've been with KHI, just some demographic type data. But here's the meat of the questions, and you're going to continue to see this in front of you, and this is in front of our staff, so that we look at this and say, we have to, as an agency, as a general agency, KHI, focus on, am I providing you the support that you need to sell and renew Wellmark products? Am I doing that? Am I giving you complete and accurate responses in a reasonable amount of time? I hope we're striving to do this, and you're going to evaluate on whether we do well on this or not. And then the third question, do we have detailed knowledge of Wellmark and its products and how to sell them? As you know, a lot of this training comes from their training classes they do for new agents and the classes that we do on the road with Wellmark. They like doing classroom training. So that's where a lot of this is going to come. We'll do some webinars, but a lot of this is going to come in terms of the training and the knowledge that we have and we give to you. So are we knowledgeable? Do you get your answers from us, or do I make you call Wellmark? I should not make you call Wellmark. I should be able to research that question for you. Now, I'll say this. Let me caveat. If one of you if somebody's got an old, I'm going to say grandfathered plan, and they're going to add somebody to it, and they need to know, well, what if they did this or what if they did that? And you need some rating information. Some of that is just so complicated, it's easier to have you on the phone asking some of those questions. And I've told our staff, we want to say, we'll go get you specifically what you're asking, but if Wellmark's going to come back and give you the answer, and then you go, oh, well, what if it's this way? And then we got to call Wellmark back. We might just say, hey, would you mind if I conference you on to Wellmark? Let's together answer this question so that we can get any other questions answered on the call instead of going back and forth, right? So we don't want to refer you and just go, hey, go call Wellmark for that. You should know that. I will say never, and I rarely say never, but we should never do that. Our role is to act as your liaison and act on your behalf and get you those answers so you don't have to call Wellmark. Okay. The training provided by my GA adequately prepares me to sell Wellmark products. You get the right amount of in-person contact from my GA. A lot of this is the training that we do, the dinners that we do, the golf outing that we do, any visits to your office, all these things. We are trying to get face time with you with a reasonable amount. I mean, everybody's got to work. You've got work to do too, but we want to make sure that we're out, we're present with you, and you'll be seeing a little bit more of me this year. And then lastly, and this one has been interesting, I don't have to worry about my mistakes or delays in my commissions from my GA. Now, you guys, my ask on this one is, please remember, this is coming from Wellmark, and I know your commissions that we send you is Wellmark plus any other carrier that you run through us. We have had challenges, as I mentioned earlier, for both Co-Opportunity and Coventry. So please, when you're answering this question, think of your commissions from Wellmark. That's what they're asking you here, and we are having struggles, but I got to tell you, it's out of our hands in most of these cases with Coventry Co-Opportunity. Okay? Now, I have to laugh because at our GA meeting that we had earlier this spring with Wellmark, kind of late winter here, we said, hey, can us and our agents evaluate you, Wellmark, and how well you do? So they entertained that, actually. We haven't seen anything on that yet, but it would be nice if they would ask how you think they're doing or how I think Wellmark is doing, okay? All right. So let's I think we're almost toward the end of the PowerPoint here, and then we'll open it up to other questions and comments. But these are some important Wellmark dates. So you'll be getting more information about all of this, but sometimes we have to hear it more than once. So you're going to be getting the invitation for KHI Wellmark Spring Training. There's 3 hours of continuing ed here from 9 to noon. We're going to be doing, I'll just tell you, we're going to be doing a healthcare reform update from Wellmark's perspective. We're going to be doing an ancillary product update, and we're going to be doing an ethics, okay? Those are your 3 hours that we're going to provide free continuing ed. We're going to be doing that at Kings Point, and it's Buena Vista. I put Kings Point in there, and I apologize. I thought it was Kings Point, and I verified and forgot to change it on the slide. It's at BV in Storm Lake. I bet Kings Point was already taken for that date on April 21st. So it's at BV, April 22nd at the Starlight in Fort Dodge. We're going to be doing 2 sessions that day because we've got so many of you that have staff that you like to split them up. You can have some go to the morning and some go to the afternoon in Fort Dodge. And then on the 28th at the Marriott in West Point, and on April 29th at the Kirkwood Hotel in Cedar Rapids. All right, so some of the other key things to notice, the agent product certification. You remember the cluster last year when they did this product certification, this brand new, you've got to get certified to sell Wellmark, and they rolled that out right about the time that we were all starting to get trained for Part D. And the confusion. So just know that this is for you to maintain your Wellmark appointment. You must product certify every year. This will be done from June 15th to July 15th. If you've got vacation scheduled in there, we trust you're not gone for the whole month. Just know right now that you're going to have to complete your product certification for Wellmark between those time frames, or you will lose your appointment effective October 1st. So it's serious. They're serious about it. If you're serious about maintaining your Wellmark appointment, take note of those dates. And then remember last year when they opened it up and they said any agent can move to any GA they want. And it kind of happened at the time where several GAs lost their contract. It was, again, boy, another cluster, wasn't it? So when they asked all the GAs just a month or so ago, how should we do this? Should we have a big deal again and go out? Remember, they did these town hall meetings and these forums, and they had the dog and pony shows by all the GAs, and it was quite an event. And most of us and most of you said, stop with the big event, okay? How about, and actually Brenda and I said, why don't you just allow a GA to move whenever they want to, an agent rather, move to a new GA whenever they want to, kind of like we do AORs in the individual now and small group market. And they like the idea, right? We like it because I say it's organic at any time. And we've always, as you guys know, KHI has always said, if you want to move, you move. We'll release you. But this policy in being very organic says if something happens or somebody needs to move to a new GA, after July 1, any agent can move to a new GA at any time, and we don't have the form yet. We'll get that prior to July 1st, but there'll be a form, kind of envisioned like an AOR form in the individual small group market, where you'll be able to say, I want to move this GA to that GA. And we support this because we want to make this a non-event, but we think it should be open to anybody because it causes us to kind of put our foot to the fire and put our money where our mouth is. And if we're as good as we say we are, then we need to earn your business each and every day. And you guys have heard us say that. So we're in support of this. We're excited about it. And we're not going to be going out and having some massive, hey, let's go get more agents. You know, we at KHI are going to focus on the service and support that we provide to the agents that have chosen KHI. That's where our focus is going to be. But I just wanted you to know that that's out there if you care about it in the marketplace. And then here, the last bullet on this slide is the SRA satisfaction survey on the GA, and I should have capitalized that A there, is happening in the August time frame. Let me just double check here. Yes, it's saying that Wellmark will be sending the head of your agency a satisfaction survey. Now get this, you guys. If the head of your SRA, your sub-retail agency, is somebody who's not actively engaged in our business, you need to tell them they're going to get this, and they need to forward it to you so that you can complete the survey. How silly would it be? Either it gets deleted, or they answer it, but they don't know how they're answering it because they're not active in this business. So we have asked Wellmark for a list of those contacts that they show that have signed the agreement, the sub-retail agency agreement, so that we can reach out to them and make sure they know they're going to be getting the survey, and to please complete it or send it to the person inside their agency that works with us on a regular basis. Okay. And one more key on that is, you know, sorry, but we're going to be driving for response rate. I mean, we were thinking of some crazy things like send us a screenshot of the final page when you've submitted it, and we'll enter your name in a drawing. I mean, here's the deal, guys. We've got a piece of our override hanging out there, not just tied to how well you rate us and how well we perform for you, but if I don't get at least 37% of you to return your survey, I don't get any of that back. So please don't be shocked if we're really kind of encouraging you guys to return that survey and try to get the head of the SRA to get it to you or to the right person to fill out. I know we can do better than 37% return rate. Our return rate last fall was 31%. Okay? So we got to do better. If you've got an idea about how we can increase you and your ability to complete that survey for us, let us know. All right. Following up here, last of the important Wellmark dates, our fall training. We will be going back out on the road doing fall training in September. This is where it's going to be key, as I talked about earlier, on groups renewing, just any clarification around pricing and products and whatnot. The next, not only Medicare open enrollment, but Affordable Care Act product changes. who's on the marketplace, who's not, etc. The renewals and premium rate changes, of course, are happening in September, and certification, as I mentioned earlier, happens in September. So a lot of stuff we're going to kick in. So, let's take advantage of this. And I think Wellmark's tried to be sensitive of spreading some more of this out over the year instead of having everything happen in the fall. Remember, too, some dates now. This is not just Wellmark. This is universal. The annual election period for PDP is October 15th to December 7th. The open enrollment for the under 65, that's the Affordable Care Act stuff, right? November 1 to January 31. And then last but not least, this is a Wellmark requirement. Maybe some of you heard about this or just barely made it, but remember, any sub-retail agency, and that means any agents that are under that sub-retail agency, have a minimum of 10 health policies they must have on the books by January 1 of 2016, or your appointment, your contract with Wellmark will be terminated. Those of you that come on during the year do get 12 months to try to perform, but just know, if you're new with us and new with Wellmark, you need to get 10 policies on the books with Wellmark, and it does not include PDP, does not include dental or vision. So get after selling those medical policies, and know also that if you can get a group, 5 health lives count as 5 policies. So if you can get a group of 2 groups of 5, you got 10 policies, you're good to go for another year. Now, rumor has it they're going to raise this number again in 2017. So the point is, they only want those that are serious about selling Wellmark and carrying the cross and shield. Last but not least, I didn't have this on the agenda, but I had to throw it in here because you've got to know, under khiagents.com, check it out. We continue to make enhancements to our website. Shout out to Darcy, our Director of Marketing. You guys have talked, many of you, with your press releases for the last contest we had, incentive reward rather. But know that the calendar of events for upcoming training, I know you guys are getting barrage of KHI emails. I'm sorry, I'll just tell you that, but I would rather have you get information from us than not. So if you see, what we're trying to do now is when we send an email, it's one topic, and we're trying to do a good job in the subject line. So you know if it's a webinar, you know if it has to do with commissions, you know if it has to do with product, or an urgent announcement, okay, or a reorganization. I mean, whatever it is, we're going to put that in the subject line so you can look at it and delete it if it doesn't apply to you. If it's individual, small group, and you don't play in either of one of those. So we're pounding it right now with webinars and training that we're doing right now. In addition, that we're going out on the road, as I said, spring training with Wellmark. But we are lining up as many of our carriers as we can to give you some of this training, that now is the time to get training and retool, get all rejuvenated before we hit the fall and before you go on summer vacation with your family. So you'll see in their webinars, classroom sessions, other seminars that could be going on, and other meetings that are scheduled. So please check out our calendar of events, and then resources for recordings of the videos and presentation slides. Look under the Resources tab, and you'll see that there. In addition, we've just added under our Resources tab a Marketing Solutions, under our Agent Solutions tab. So we've got a Resources tab, and then we've got an Agent Solutions tab. And under our Agent Solutions tab, among other things, along with our Wellness Solutions, take a look at that. We've revamped that page. We've added Marketing Solutions. And we're calling it campaigns because this is where you guys have said, hey, do you guys have a letter I might want to send to my clients? Let's start to get all this retooled over the summer now, so you're ready to go in the fall. We've got some sample letters out there, and we will continue to beef up this section so that you can look out there and say, I'm looking for a letter that I can send to my clients that are still grandmothered, or my groups that are still grandmothered, whatever the case is, right? Or those turning 65 letters. We're working on a postcard that we'll get out to you guys as well, or be posting it on here and let you know. So that is probably the longest I've talked in a long time. So I know we're coming to the end of our call, so I'm going to go ahead and open it up for any questions or comments. I will scroll down through too and see if we've got anybody that has raised their hand. I don't see any hands raised, but I do see a question. Okay, so here's a question. Looks like from Paul saying, are AORs count for the SRA minimum count? So yes, if you get agent of record change, and you got to get it done, of course, before. See, some people got them, but it was effective 2/1, and they had to have 5 policies by 1/1. So those didn't count for them this year because of the AOR changes in the individual market. But yeah, ongoing, absolutely. If you can agent of record change policies in your name, just get it done prior to January 1 of 2015. But yes, it counts for the minimum of 10. Good question, Paul. Another question from Brenda. Do you think we should anticipate moving our grandmother groups who renew after 10/1 of 2015 to an earlier renewal date this fall? Wow, that's a good question. Obviously, yeah, I'm thinking through that. I think that if they have a case, if their case is such that they want to protect it for another year, yeah, so it really is those November and December renewals. And I want to tell you guys that I talked to Kathy about getting renewals. What if we have somebody that, and I'll use this example, they're a 2/1 and they want to come back to a 1/1, or in your case, Brenda, let's say it is an 11/1 and they want to pull it back to a 10/1. Wellmark tells us they need 4 months notification prior to that renewal date. So if you were supposed to renew in, I'll use this example of February, but you want to renew in January, now you got to back it up 4 months from there. So they need to know, I believe I did this calculation yesterday, they need to know by September 1st that you want to have a January 1 renewal so that they've got time to run that renewal, because that's going to be out of their normal sync of running their renewals. So good question. And any more specifics on some of those cases, just give our office a call, because I'm not sure which carrier that one might be with. And each carrier might have some different guidelines. So we'll look into that on a case-by-case basis. Let's see, Donna's got a question. Does the Cadillac tax apply on both the individual and the group market? And yes, it does, Donna. Great question. Great question. Yes, it does. I think my extra comment on that one for groups is the employer controls what they're offering. If they only offer a Cadillac plan, that individual employee is kind of toast, right? So the employers need to know about it, but many of them offer multiple plans, and so the individual employee could select for the lesser plans. But yeah, it's applicable to both markets. And a question from Scott here on grandmothered plans. Do you anticipate Wellmark will allow our December 1 renewals to have the option of an early renewal, similar to Brenda's question, prior to, like move to an October 1, as was done previously with non-ACA compliant plans? That's my understanding, Scott. And so on some of those where you've got those renewals, yeah, good kind of a heads up right now. Let's start doing some legwork on that. And of course, we won't have the renewal to know, right? Should we stay or not? I mean, if we get a renewal and it ends up being worse than the ACA plan, some of them are going to want to move to ACA plans. But I guess, yeah, that would all happen once you put in for the early renewal or to move that date. So good questions. Other questions, other comments. Here's one from Tanya. Thank you. Do you know if Wellmark is going to plan to be on the marketplace for 2016? Great question, Tanya. You know, they haven't shown their cards yet, and you know, I think a lot's going to happen on. Let's see what happens with the Burwell decision in June. Although they need to make their commitments, I believe, if they're going to be on or not, right about that time. So timing of that Supreme Court decision and whether or not Wellmark will be on the exchange will be very interesting. My speculation, I probably shouldn't say, but I'd be surprised if they are. Kind of like, why would they? But that's just me. But that'll be a great question, and you know, let's ask it in April when we're at Wellmark's training and just see what their response is at that time, because they've got to be working on it if they're going to get in it. They've got to be doing that sooner than later. Let's see. And Larry says, how does the Cadillac tax work on self-funded? You know, there's a section on that I was reading on that, Larry, and I think I have it in front of me. But there is a piece on that with the self-funded. Of course, it applies to them as well. Let me get some more details for you on that, Larry. And if we find out it's big enough, then we'll push it out for everybody and just put that out on our news. But I know I'll be seeing you this afternoon, so I'll get that and we'll discuss it this afternoon. I know it applies to self-funded plans as well, though. They are not exempt from that Cadillac. Let's see. Any other questions or comments? here. See if anything else pops in here. Let's see. Okay, Frank, thanks. I got yours here, Frank. And Frank says, how long will grandfathered plans be able to stay grandfathered before they need to change over to ACA plans? You know, Frank, unless the legislation changes, the grandfathered plans have the right to stay grandfathered forever. And it's interesting because I think each group will continue to look at their rating, to see how they're doing on their grandfathered plan, and how those rates are going up, or are they kind of staying steady. And then also always kind of taking a look at ACA plans. And so, yeah, they'll be able to stay grandfathered forever. And again, unless legislation changes and something changes in the law, and I don't see that happening. So, good question. Thanks. Any others? We can wrap up. Just a few minutes left. Here, last call. Dawn, hey, I got yours, Dawn. Okay, what if a plan is currently grandfathered, but they have grown and are now over 50 lives? So maybe what you're suggesting there is, Dawn, they're part of the small group rating, right? And they're grandfathered with a small group, and I say small kind of in quotes with the definition. Now, depending on the carrier, let's say it's a Wellmark, and we know how Wellmark rates, and most obviously all the carriers rate 1 to 50, and they're in small group. But if they're grandfathered, obviously they answered health questions years ago when they bought their plan, and so as they continue to add people, that's been, I'll tell you, that's been a conundrum. Now, they get to stay grandfathered, so they're going to continue to add people, and I think what's going to happen is, over time, if they get big enough, they might see either A, we should look at self-funding, right? And then they'll end up moving to ACA compliant plans, right? Because just like we kind of went through this with another agent in their case a couple months ago, that when you're in that over 50 space, at least until small group definition changes, if it really does, with the ACA plans around self-funded plans or those large group plans, it's interesting because now, as you know, you can really pick and choose what you want to offer. You're not using these canned small group plans anymore. So it's really now going to be evaluated. They can stay grandfathered for as long as they want to, even though they're growing over 50. But what's interesting is if they want to move, it makes sense for them to possibly look at an ACA quote and looking at the rating as they get bigger. And, of course, their sickness and, how well their claims and all that kind of stuff. So yeah, so they can stay where they're at. Stay where they're at. So, yeah, will they stay grandfathered? Absolutely. Even though they're growing, they'll stay grandfathered in that plan. And it's funny because this is some of the things that are happening now. The carriers, in particular, Wellmark, we've had a couple of situations with. Wellmark's like, I don't know what we do. We've never had that before. But we know that the law says that that group can stay grandfathered and stay with that product. And, of course, we know that can't change. They can't modify it, beyond a certain measure. Then it becomes non-grandfathered. So they, by law, get to keep their plan. They'll just keep adding people to it. But at some point, it might make sense for them to move to a different plan, depending on, like I said, their claims and or their size. Great questions. Okay. Wow, you guys are awesome. You guys are awesome. So I don't see any other questions. If I missed you and you had one, just go ahead and email it to me. I'll be here in my office, and I'll respond to that right away. Have a fantastic weekend, you guys. Thanks again for your business, as always. We just cherish you, and we'll look forward to seeing you or talking to you again real soon. Take care and have a great week. Bye-bye.